I'm here to tell y'all about cystic fibrosis. But first, we're going to talk about cell communication. Cell communication is the language that all cells use to make sure that each one is doing their correct function and constructing what they need to construct. There are two main types of signaling, local and long distance signaling. I believe most of us here have talked about local and long distance signaling, but local signaling is between two cells that are touching one another, and long distance signaling is between talking with two cells that are in different areas. What exactly is cystic fibrosis? Cystic fibrosis is caused by the deletion of the delta 508th amino acid, which is located on chromosome number 7. This deletion causes the CFTR gene, or the cystic fibrosis conductance regulator, to be unable to send out the message to the cells to construct ion channels, which move negatively charged chloride ions out of the cell. And since the delta 508th amino acid has been deleted, the body does not know how to get rid of those chloride ions. So they just build up and they cause a massive buildup of sticky mucus in the body. This right here is the location of the mutation, and right about there, and also found on my board, there's a picture of chromosome number 7. Where it's marked in red, that's exactly where the CFTR gene is located and where the mutation is occurring. Here's a picture of a normal CFTR. As you can see, the chloride ions are here regulated by the CFTR out of the cell. But here's a mutated CFTR, and this yellow right here is the mucus, and these boxes are trapped bacteria. As you can see, these chloride ions are all stuck in this little area and inside the CFTR because the mucus right here has gotten so thick. Chloride ions build, whenever you sweat, your sweat tastes salty because your chloride in your body mixes in with sodium. And it forces your body to send water there to get rid of all the excess salt. So since the chloride can't get out to bond with the sodium, the body can't send out water to break down the mucus and thin it out. So a thick layer just keeps building on and on and on. And this causes bacteria to be trapped, and it causes infections in the lungs and different infections around the body. Right here is another picture of it, a really good picture of it. This right here is the CFTR, the little squiggle right there. And chloride ions are being sent, just the wrong one. Right there. Chloride ions are going out of the CFTR, and they're bonding with sodium right there to form salt. And the mucus, as it goes out, it gets thinned out by the water that comes in due to the salt. Right here, the CFTR is nowhere to be found because the delta 508th amino acid didn't give the instructions to the CFTR for the cells to build the ion channels to move the chloride. So it has to go through another way. And it can't bond with sodium, which means that there's a large mass of mucus that builds up in the cell. How is it a cell communication disorder? Due to the delta 508th amino acid being deleted, there's a reception problem. The cell can't receive the instructions to build the channels, and this causes as I said before, the CFTR gene transduction regulator. This is two different types of CFTR1 and CFTR2. CFTR2 is the transduction regulator. Since the CFTR, the cystic fibrosis conductance regulator, it can't get the message. Transduction can't occur with the CFTR2 gene, and this will be unable to send out the signals to the cells to build the channels. How do you get it? It's an autosomal recessive disorder, so that means you have to receive a copy from both your mom and dad. Right here is a picture of it. So these are a mom and dad right here both have CF, they're carriers of CF. So big A, little a. Since it's a recessive disorder, little a stands for cystic fibrosis. And if they have one child, they have a 1 out of 4 chance of them getting cystic fibrosis, their child having cystic fibrosis. 1 out of 4 chance of their child not having it at all, and 50% chance of them carrying the disease. Symptoms of it: many people who get diagnosed with cystic fibrosis have the same symptoms, including salty tasting skin because of the buildup of sodium chloride and the water not being able to move sodium chloride out of the body. Persistent coughing with mucus, which is excess phlegm. Persistent coughing with phlegm, which is excess mucus in the lungs. Frequent respiratory infections due to bacteria getting caught in the mucus and not be able to get out. Wheezing and shortness of breath. Many people who have cystic fibrosis actually can't play sports due to the fact that they can't pass a breathing test, like if we took a physical. Infection of the pancreas and digestive system. or delayed development of reproductive organs. For males, this causes infertility, so they will not be able to have children, most of them. And the pancreas and digestive system infections. In your body, your digestive system is lined with mucus to help you absorb nutrients into your body so you can get bigger and stronger. And you'll soon see right there in that picture, you see the little girl, see how thin she is? Her body's not able to absorb all the nutrients in her body, so she can't grow and she can't build up muscle. Treatment of it, there are a variety of medications to help with the symptoms of it. However, there's no long-term treatment yet, or no long-term cure, antibiotics to treat and prevent lung infections, anti-inflammatories to lessen the restriction on bronchial tubes in the airways of the lungs. There are also inhalable medications called bronchodilators. Those are, think of it kind of like an inhaler. Whenever you take a puff of the inhaler, the medicine goes out of the inhaler, down your esophagus, into your lungs, into the bronchial tubes to help you be able to breathe easier. And that's what it does. And there are also oral pancreatic enzymes, so like a pill. Whenever you take it, it helps your digestive tract absorb the nutrients and thin out the mucus. Right here I have a video about the cystic fibrosis vest, if it will play.
My name is John Palmer, and this is Cystic Fibrosis My Way. I'm 15 years old and have been treated for CF at Children's Hospital for as long as I can remember. But it doesn't get in my way. I just make it part of my day. When I grow up, I want to play basketball for the Cleveland Cavaliers. It's an exciting team. Maybe play with Kyrie Irving. He's number 2 on the team. If I want to play basketball professionally, I need to make sure I do my therapy, my nebulizer, and my huff coughs every day. 2 times a day when I'm healthy, and up to 4 times a day when I'm sick. First, I take 2 puffs of the inhaler. This opens up my airway. Then I hook the machine up. I put the vest on the clamp and then I buckle it. Now make sure the holes are inside the vest. After that, you have to put your tubes in. Then I put the medicine in the nebulizer. Next, I turn the nebulizer and vest on for 20 minutes. My pressure is 7 and my frequency is 11. That's how fast it goes. But every kid has a different setting. Just make sure you know what your doctor told you to do. Sometimes the treatment takes longer if there's more medicine to do. After 10 minutes, I do my huff cough.
Right there, the huff coughs that he does right there is just to get the excess mucus out of his lungs. As you can tell, whenever he talks, he sounds like he's stopped up, just like if we had drainage problems, like if we were sick with drainage. He sounds stopped up because he has mucus built up all in his lungs and he's unable to breathe. Until CF stands for Cure Found, the month of March is, they've represented the month of March for cystic fibrosis. The CF organization, Cystic Fibrosis Foundation, has been working hard on trying to find a permanent cure for it. However, they have not found one yet, but they're really close. Amphotericin is a medicine that they're working on. It's antifungal medicine that they've been trying to use, and it's been working. And it bridges the gap where the delta 508 amino acid would be, and it helps the body be able to fight off infection easier instead of having to worry about the CFTR gene not being able to work and building up mucus and bacteria getting caught. It kind of works as an antibiotic, but works there. Instead of taking it on a daily basis, you only take it like once a week or something like that, instead of having to take so many medications for it. And that's all I have.